My name is Dr. Jeff Aberle. I'm from Madison, Wisconsin. I'm a chiropractor. What originally interested me in ABC was I had experienced it actually at another technique seminar. There was somebody there doing it, and I'd experienced it there, and that was eye-opening, but for some reason I was closed-minded and didn't look into it. I look back at that and I go, oh, what was I thinking? But then it was at another technique seminar where this guy told me about this first rib maneuver thing. And I ended up ordering the free DVD packet. And I got that, and I did it on myself. I remember in the living room, it was such a shocking moment when it happened. Because all of a sudden this pain I had at C7T1 that had always been there and nagging me was like gone. And I was like, what? You know, it didn't make sense to me. But I'm like, okay, so this guy clearly knows more than I do. I've never seen anything like this before. Here, I do this little karate chop with my own collarbone here, and I feel so much better. So I call him up, and next thing I know, like a month later, I'm at a seminar. I'd got the complete the two manuals and everything like that, read through them all the time, all before I got to the seminar, took the seminar, and that was awesome. It was so neat and I remember after being adjusted that one night too, I was just so upright, and I mean everything felt so rearranged in my body, and I'd never experienced anything like that before, and that was just life-changing. And I look back at it, and I'm so glad that I did that. And there was a few opportunities in there where I just didn't take that step. And I look back, I don't know why I didn't, but I eventually got here, and I've been doing it now for a long time, and I really love it. The big reason my colleagues should be interested in this is healthcare is changing, in my opinion. I think things are going to radically change towards outcome-based results, and those results better be consistent and predictable, and healthcare is the least. I mean, healthcare, consistency and predictability in healthcare right now do not exist. Everything is very unpredictable, especially when it comes to chiropractic or physical therapy, massage, anything like that. It's a hit or miss game. And advanced BioStructural Correction is consistent and predictable. And that's what I love about it. And if people don't change the way you think, there's actually a reason for it. And so that's nice too, because you just figure it out. Eventually you get it all figured out, and the person unwinds, and they start feeling better. And you start seeing changes right away. But I did a lot of muscle work techniques, two of the major muscle work techniques in the chiropractic profession. And yes, you feel a little bit better after you have those done. But compared to even just one or two, like the first rib maneuver and the getting the C7, nothing can come close to making you feel different like that. And I did one of these interviews 3 or 4 years back, and if you go look at that interview, if we have that, you could see my body is completely different in that interview. And I thought things were great then. Well, I knew things were goofier, but I'd been treated, and I was feeling more upright, in my opinion. And but I look back at that, and I'm like, oh man, I did not look good. Did not look good at all. And now I'm feeling so much better. Oh, and the other neat thing is that the curves actually change. And that, I can't tell you. I mean, I tell my patients and stuff, I'm really into the curve restoration business. And that is what gets rid of the pain. It's what makes you healthy. And if I could snap my fingers and restore your curves, boy, that would be worth 10 grand easily, because you'd be just on top of the world. And that's what ABC does. You can't do it that fast, but it does change. It takes some time to unwind the body, but you start seeing the pain relief right away, which is kind of like the nice side effect of it. You start seeing the pain relief changes right away, and then you can take the unwinding further if a person wants to do that and really restore their health.